Get ready for an enlightening session as we dive deep into the world of atopic dermatitis with the skin expert himself, Pharmacist Ben Fuchs. Known for his innovative approaches and practical insights, Ben is here to unravel the mysteries of this challenging condition and share actionable strategies for managing it. So whether you're a sufferer from this condition or you're a healthcare professional or just keen to learn more, you won't want to miss this live stream. So let's give a warm welcome to Pharmacist Ben Fuchs. Handing it over to you. Yay!
Yay, Ben Fuchs.
Okay.
Well, I was going to share my screen, but because we've had all of these problems here, I'm not going to get to share it. There's a really interesting article that I want to share with you. I read an article this morning. I'll just read it to you. It says this is from MedPage today, one of the medical websites that I subscribe to. The headline is Preventing Atopic Dermatitis. It says, preventing atopic dermatitis, does anything work? And it just really struck me as being unfortunate. Atopic dermatitis, also known as eczema, the technical name is atopic dermatitis. And in the name atopic dermatitis, you really have the clue to what's going on. Atopic means not topical. Derma means skin. Itis means inflammation. So atopic dermatitis, what we traditionally call eczema, is an inflammatory condition, itis, of the skin, derma, that is not related to a topical problem. In other words, it's related to a systemic problem, a problem inside the body, that is inside the blood. I always say all disease is cell disease, and all cell disease is preceded by dirty blood. Eczema or atopic dermatitis is no different from any other health challenge that's chronic and degenerative. It's all about the blood, which means it's all about the intestine, because the major source of blood toxicity is a leaky gut. It's toxicity that enters into the bloodstream through a leaky gut. So atopic dermatitis in this way is like any other chronic inflammatory condition. What's tricky about atopic dermatitis is because it's on the skin, it looks like it's a skin problem. And this is why most of our strategies for dealing with this condition involve rubbing a cream on your skin, typically a steroid cream or maybe some kind of anti-inflammatory product. If you're an alternative practitioner, you may use coconut oil or oats, which have anti-itch properties. Nonetheless, if you really want to address the problem, you got to get into the system, the blood system, the internal system of the body, which of course means digestive health strategies. So when I read this headline, Preventing Atopic Dermatitis, does anything work? I thought to myself, well, yeah, if you're a physician or you're a dermatologist, you're a representative of the medical model, you think, oh, does anything work? Oh, we have to give immune suppressants or steroids or so-called biologics, which are high-tech immune suppressants. This is the thinking of the medical model. No knock on doctors. They're good people. They want to do a good job. But the medical paradigm sees diseases as reason to medicalize. The famous psychotherapist Alfred Adler said, if all you have is a hammer, everything looks like a nail. And because our medical representatives only have drugs to deal with things, they look at everything as they look at disease states or symptoms as druggable or medicalizable, if you will, health challenges. I'm here to tell you that eczema, atopic dermatitis is not medical. It's a lifestyle. And if you're dealing with this unpleasant condition, you can resolve it quickly. The skin, as it turns out, problems on the skin resolve very quickly because the skin turns over very quickly. The digestive tract and the skin are the two fastest moving cellular systems in the body. And that means if you have a skin health challenge like atopic dermatitis today, next week you don't have to have it anymore if you correct the blood toxicity problems, which means working on the leaky gut issues and the upstream problems with leaky gut. Oh my goodness. The upstream problems with leaky gut. So what we want to do here when you're dealing with atopic dermatitis is, number one, focus on digestive health strategies. That means using your I-26 from Longevity, your ultimate enzymes from Longevity. I'm going to grab this real quick. Hey, Diego, I'm on a podcast. Can I call you right back? I'll call you right back. Sorry about that. You want to deal with digestive health strategies. That means I-26, which kills excess bacteria that are the cause of small intestinal bacterial overgrowth conditions, SIBO. We've talked about this in the past, using your ultimate enzymes upstream from the intestine, using apple cider vinegar and betaine HCl, which you'll find in your ultimate enzymes, both work upstream. Bile salts, which are in the ultimate enzymes, again, work upstream. The daily digest product, these are all digestive health strategies, and we've talked about these at length. Also, the skin barrier, which is defective when you have atopic dermatitis, there's nutrients you can take to strengthen that skin barrier. Number one, essential fatty acids. In fact, if you pull essential fatty acids out of the diet of a laboratory animal, you're going to get eczema, or that animal will get eczema or atopic dermatitis. That's how intimately connected essential fatty acids are with skin conditions, particularly atopic dermatitis and skin barrier conditions. It turns out that moisture factors that are very important for keeping that stratum corneum or skin barrier functional are derived from EFAs, and EFA deficiencies are very common. Also, if you have digestive health issues, you may not be absorbing your EFAs, which is why you always want to work on digestive health first. So once you've taken care of the digestive health issues, you're going to want to supplement with your ultimate EFAs. I particularly like the ultimate EFA plus, but either one. GLA in the ultimate EFAs is a well-known anti-itch and skin health supplement, as well as omega-3 fats and omega-6 fats. Also, fatty vitamins like vitamin A and vitamin D play a very, very important role in skin health. Fatty minerals like zinc and selenium are also important for your eczema patient or your atopic dermatitis patient. And it's no accident, by the way, that kids and adults who have atopic dermatitis also tend to have issues with asthma and ear infections in children. They all go together because these are all the result of immune activity that follows a leaky gut. So for your eczema patient, your atopic dermatitis patient, step number one, work on digestive health. Eliminate problem foods. I forgot to mention that. You'll notice, or your atopic dermatitis patient will notice, that certain foods will trigger an eczematic condition. So you're going to want to stay away from problem foods. Always do a food diary. You notice I'm repeating myself. We say this over and over and over again. With other health challenges, and atopic dermatitis is no different. So you're going to want to do a food diary. You're going to do all the digestive support. I forgot to mention probiotics. Your Nightly Essence probiotics are wonderful. Probiotics are a well-known and very successful nutritional treatment for atopic dermatitis, among other skin health conditions. And then the daily digest supplements, the I-26, all the digestive health supplements, in addition to eliminating problem foods. Then you want to use your fats, fatty vitamins, A and D especially, as well as essential fatty acids, particularly the fatty acid GLA, which is a derivative of omega-6, and omega-6 and omega-3 fatty acids. Some people like to use fish oil. Fish oil doesn't have fish oil doesn't have essential fatty acids in it, but it does have two very important omega-3 fats called DHA and EPA, both of which can have very important skin health benefits. And then the mineral zinc, which you'll get in your Longevity Opta Zinc, or selenium, in your ultimate selenium, those can also be very important for your eczema patient. If you want to do something topical just to relieve the itch, you're not going to really be able to resolve your condition topically, but oats or oat oil, which contains omega-3 fats in it, or oatmeal baths can be helpful for just soothing and relieving the itch. Topically, fat soluble, has to be fat soluble. Vitamin C can help, particularly a form of vitamin C called THDA has a very soothing effect on eczema. It can actually help restore the skin barrier. Topical niacin can help. Our topical fucoidan may relieve some of the itch and some of the discomfort that's associated with eczema. Eczema, atopic dermatitis is not only unattractive to look at, it also can be very uncomfortable. And if you apply topically your Fucoid Z, which is not really a topical product, it's an internal product, that can give you some benefits. And zinc oxide, which delivers zinc, can also give you some benefits. You can actually even break up your Zinc FX and put it in your fucoidan and make yourself a little fucoidan solution, topical solution that you can apply to the skin directly with zinc in it. You can also, if you really wanted to do it, you can also put a little bit of oat powder or ground oats in the solution, and that'll give you some extra anti-itch benefits. None of these are going to resolve the problem, but they can give you some symptomatic relief. Resolving eczema is very easy, though. internal fats, EFAs, vitamin A, vitamin D, zinc, and selenium, work on digestive health, eliminate problem foods, and your atopic dermatitis that you have today can be gone within 2 or 3 or 4 days. As I said, the skin conditions resolve very quickly because of the rapid turnover time of skin cells.
Great. Thanks, Ben. And just
you.
want to bring everyone's attention to follow us on YouTube at Young for Life Now, because there's a load more videos there where Ben's giving in-depth education on digestive support and some great videos there to watch in conjunction with what we've just seen.
And you know what? While we got you, if anybody out there likes health, likes nutrition, I know there's a lot of folks who like nutrition and nutritional supplementation and dietary strategies. I get all kinds of letters from people who say how much they enjoy these chats. We're looking for folks who can join our team, that we can teach how to help other folks, how to help other people resolve health challenges, and how to help other folks use nutritional supplements, particularly the longevity nutritional supplements. And we can teach you. You can become an expert on your own, and you can help other people downstream. We're looking to we're looking for business builders who want to, number one, help people, number two, learn about nutrition and learn about health, and number three, who want to make a business or want to make some money, side money or a full-time income from helping people, from making a difference, a positive difference, and helping people make a positive difference in their lives and resolve their health challenges.
So shoot us an email at info@pharmacistbenjaminfuchs.com and we'll get you started on Ben's in-depth personal coaching. So it's one of a kind.
Thank you, Michelle, and thank you, everybody. We'll see you on our